I do a lot of drawing. I'll oftentimes get out a sheet of paper and I'll draw my little fried egg version of a melanoma cell, and then draw the T cell and draw the receptors that we know are most important in terms of that tumor cancer and that T cell immune system engagement. And by drawing the receptors, I think they can understand how these drugs act as on-off switches for the immune system, and sort of tell them, this is something that your body sort of already knows how to do. Your body's immune system knows how to protect you. What happens is the cancer overwhelms that ability, and then that's what allows it to grow unchecked. So we're figuring out ways to get your immune system back on board and to recognize that cancer and go in and kill it and keep it out. And I said I always tell them that the whole concept of immune therapy is because we're using your immune system, once that cancer's gone, it tends to stay gone. So it's not like with chemo where we have to worry about it potentially coming back. And I think that drawing helps a lot, just because it sort of helps them understand what are the two key players that we're really trying to focus on and how these drugs are working. And I think it also helps them understand with targeted therapy too, which part of this puzzle are we actually focusing our efforts on? So maybe I'll cover the T cell and just show the cancer and say, this is where this targeted therapy can work. And look what happens when we put the two of them together, which is oftentimes a question that comes as a follow-up to my little diagram. And then using analogies. Patients are very smart. Their health literacy is generally much better than most of us expect, but it's still an overwhelming amount of information on the internet. So for me, using analogies that help them understand and make that teaching a bit easier can also help. So as an example, I'll say to them that, let's imagine that your T cell is a horse in a race, and this drug is the jockey that's going to whip it faster across the finish line. And that's something that's easy for them to get. They understand that. So it usually just comes down to what analogy tends to work for you in terms of explaining things, and then just use that consistently.